Hello everybody, welcome to Sheena Guides. I'm Sheena Phillips. So today I have got one of the most important topic we have, and that's about cervical cancer, which is one of the most global problem we face, and this problem can be prevented by following these two simple steps. So watch till the end of this video to find out what are these two simple steps which can be followed and you can prevent cervical cancer. To know a bit more about cervix, what is cervix? Cervix is a door to your uterus, or it connects your vagina, the female vagina, to the uterus. It's a door for the uterus, means it protects the uterus from getting the infection. So just to give you some facts about cervical cancer, 75% to 80% of the cervical cancer can be prevented with a smear test. 2 to 3 women lose their lives every day with this preventable disease, and 9 to 10% of the women are diagnosed with it in every day. So just to give you a bit more, in UK, after the breast cancer, cervical cancer is the second most cancer we have in UK. In the developing countries like India and China, they have the major women's cancer is the cervical cancer. And if you look at in UK, the Asian population or the African population are the women who get more cervical cancer than the English population. So why is that? Just follow this video and you will find out the reason why we get more. What are the reasons some women are more prone to get cervical cancer? How do you get cervical cancer? So you get cervical cancer from the infection from the human papillovirus. So HPV virus, which you must have heard about. So how do you get this HPV virus? Human papillovirus is, you get it when you're any woman who is sexually active gets this virus. So there are hundreds of strains for this virus. Normally, the body gets rid of itself. But for some unfortunate women, the body can't get rid of itself. So I'll tell you the reason why the body can't get rid of itself, just a bit more detail afterwards. So when the body can't get, so as I said, the infection from the human papillus, when usually they have no problems, the body normally gets rid of itself. But in some cases, the body can't get rid of itself, and that virus can change the cells. And once this causes the cells to divide out of control, and this can lead to cancer. So as I said, there are hundreds of strains of HPV virus, but there are only 2 or 3 strains. Basically, the number 16 and number 18 strain is the one which causes the cervical cancer. So so this is the main thing what you have to find out. So HPV virus is the main cause for the cervical cancer. Right. So as I told you, what is the cause for the cervical cancer? Now I'll tell you why for some women the body can't get rid of the HPV virus. So mainly is the majority of the reason, mainly is that people who have multiple sexual partners or people who are smokers. So what happens when you are a smoker is that the internal lining of every organ is damaged, including the lining of your cervix. So the body can't get rid of itself. It just sticks to the body. So that's one of the main reasons. So how can you prevent cervical cancer? The first and foremost is getting HPV vaccine, which is now given to the school children. Second one, it's getting a smear test. Third one, using protection when you're having the sex. And the fourth one, don't smoke. And the fifth one, limit your sexual partners. The first tip is to get HPV vaccine. It's normally given to children, girls and boys at the age of when they are 12 years, that's when they are in year 8, they get their first vaccine. 6 months later, they get the second dose. From 2019, the boys also is being started getting this vaccine in UK. Why? You may be asking why the boys are getting. Because they found out that HPV virus is one of the main cause for the oral cancer, and that's why now the boys are also getting HPV vaccine. The The second tip to find out how can you prevent cervical cancer is to get your cervical screening done. In cervical screening, we look for precancerous cells. So when is it done? In UK, it is done, you get the first invitation 6 months before you turn 25. So that is by when you're 24 and 6 months, you get your first invitation to get your smear test done. And then after that, it is, if you're between 25 to 49, you get every 3 years if your previous test was normal. And from 50 to 64, it is every 5 years if your previous test was normal. If above 65 and you've not, the last 3 tests, you've not attended your cervical screening, or your last 3 tests was abnormal, you get 1 test after 65. Otherwise, after 65, normally you don't have a smear. One normal question is that what will happen when you are pregnant? When you're pregnant, normally we don't do a cervical screening, but if you had a previous abnormal smear, then the obstetricians would have a look into and decide based on that. So we have to wait 12 weeks after your birth of your baby to get your smear test done if you are due for a smear. Right. So when you get a letter for an invitation, you go in UK, I'm talking about in UK, when you get an invitation for a cervical smear, you contact your GP, the practice nurse, and get an appointment from her. So normally what happens is that when you go in, she will explain to you what the cervical screening is and what you have to expect during the examination and what the results are. Okay, what are the equipments used? This is the speculum. This is the speculum what we use for to examine your cervix and look at your transformation zone and everything. So this speculum is a plastic speculum. It's used only single use, and it's in different sizes, small, medium and large. And also we normally apply a gel, lubricant gel to the speculum, so the pain is you don't get any pain. You feel uncomfortable, but then it should not be painful. And this is the part what we put the cervical thingy, and this is the brush what we use for taking the smear. So what are we doing in cervical screening? So when we do cervical screening, we are looking at the cells before it becomes cancerous. As I said, the precancerous cells. So it tells us before it becomes into cancer, because cervical cancer, like the precancerous cells, can be there in your body and it can stay for 10 years and then become cancer. We pick it up before it becomes cancer, so it stops the cancer from developing, and it's one of the highly effective method of preventing to find out the cervical cancer, and we save around 4,500 lives a year in UK. And in US, this smear test is also called as pap smear. In US, it's called as pap smear. In UK, we are so privileged that we get a free recall or free call to come and attend for a smear test. But this is not the case in other countries. So I think what you have to do is that any woman has to do is that book an appointment with your gynecologist or book an appointment with the practice nurses to get your smear test done. Because we look after everybody else's health in our family. We look after our children's health, we look after our parents' health, we look after our husband's or partner's health, but we don't look after ourselves. So I think the way we can look after is to book an appointment for getting your smear test done, because that will find out a precancerous cells before the cancer gets developed. As I said before, what does it look at? It looks for high risk HPV virus and it only takes 5 to 10 minutes for the 5 minutes to take that procedure. So it's that 5 minutes changes your whole life. But this is not when you have symptoms. It is before. This is like a routine checkup. So if you have any symptoms like any abnormal bleeding or pain while having sex, or if you have these symptoms, you need to contact your GP to get an urgent appointment, to get a referral to the gynae team. So let me explain to you what the result is, because you all get the results by post into your home address, and it will explain different terminology. So let me explain what it is. So the first result would say that no HPV is found. So as I said before, what here we're looking is whether you have got humanopapillovirus or not. So if you don't have any humanopapillovirus, that means that you don't have any high-risk HPV virus. So that means you're okay. So if you're between age 25 to 49, you get your next recall in 3 years' time. But if you're over the age of 50 to 64, you get a recall for 5 years. So the next one is that probably in your letter, the result letter, it will be like you have an HPV is being found, but there is no cell change. What does that mean? Means that you have got HPV virus, but as I said before, there are many strains of, it's only two strains which causes into precancerous cells and causes into cervical cancer. So you may have HPV virus, but that has not caused any changes to your cervical cells. So what we will do? So we're not worried about that, but we will definitely re-invite you in a year's time to check what has happened, how is your cell change, and what is the, what is your latest cervical smear would be. So the third result would be like the result may say that they have found HPV, and also they have found some cell changes. What does that mean is that you have got high risk HPV virus, and that is also causing some changes to your cervical cells. So if you get that letter, what happens? The next step will be you will be invited to colposcopy clinic. What has happened in colposcopy clinic is that they put a dye in and see how much of abnormal cells you have, and they take a biopsy. The biopsy will tell us what type of cells it is, whether it's a high-grade cervical cancer cells or not. Sometimes some patients can get it as inadequate in their result. So what does that inadequate means? That when we take a smear, probably the sample when they are tested, they couldn't get enough cells into that, or it cannot be seen properly under microscope. This normally happens when you have periods and when there is blood stained in that. There is heavy blood stained in that. They can't find out. They can't detect the cell change. So that comes as inadequate, and we can only repeat it after 3 months, because the cell starts completely developed only after 3 months. Hope everybody understood what are the 2 simple steps you can follow to prevent this cervical cancer. Just to reiterate again, one is to have your HPV vaccine given to your children when they are in year 8, both boys and girls. Second is attending for a cervical smear. So in families, tell your wife or your partner or your spouse to go and attend for the cervical screening. It saves their life. Thank you very much for watching my video. Please post in your feedback or comments about this video, and let me know what further videos you want me to put in. Thank you very much.